Uh, I'm presenting the second abstract presenter, Dr. Hamindika Saparamadu, and his abstract is on eliminating vertically transmitted HIV and syphilis in Sri Lanka, the role of social determinants of health. Dr. Saparamadu, he is having MBBS, MPH, postgraduate diploma in health economics. He is a public health professional with advanced training in epidemiology and biostatistics from the Johns Hopkins Bloomberg Social School of Public Health. He is a member of Delta Omega Public Health Honorary Society and has completed the Health Policy Institute Fellowship at the Maryland General Assembly, recognized as one of the 20 under 40 Sum of Health Promoters Finest by the American Journal of Health Promotion. Dr. Saparamadu has also received many awards for excellence in U.S. public health practice. He currently serves as a research associate at Johns Hopkins Medicine. Dr. Saparamadu, so over to you.
Thank you very much for the lovely introduction. Good afternoon, everyone. So we are here to talk about dual elimination, or vertical transmission, dual elimination, the story of dual elimination in Sri Lanka, the success story as of 2019, and how social determinants of health play a role in this story. So my name is Samandika. I'm presenting the work done both of me and my colleague, Nimasha Fernando, and here are our affiliations as well as our contact details. We have no conflicts of interest to declare. And thank you very much. We want to first of all thank the organizing staff and the session chairs, as well as especially the reviewers for the wonderful comments to improve the quality of our work. So this is we'll start with the usual story. We'll start with the general objective. So we wanted to identify the social determinants of health that contributed to this successful elimination of mother-to-child transmission of HIV and syphilis, or dual elimination in Sri Lanka in 2019. I want you to focus on the specifics here. So first, to identify a comprehensive list of things that contributed to the success story, and then we wanted to develop an evidence-based and experience-informed framework to understand how this elimination process might work in our local context. There are some applications, practical applications, but we'll talk about it towards the end. So this is a systematic review. To start with, since I'm a person who's not in HIV, so in case you're wondering, so my expertise are mostly in non-communicable diseases, and my contributions were from the social determinants, whereas my colleague is in global health in HIV with PEPFAR funds working in Africa. We wanted to first of all identify what were the key determinants in this story. We drew our professional experiences. We'll get to that later very briefly. So we wanted to get everything in together to understand what is our approach, as well as how we are going to strategize our search. So if you can focus here, we wanted to create the search strategies, and we use the PCOS method and the mesh terms, the usual, the keywords, as well as operators across all the databases listed here: Cochrane, PubMed, Scopus, Web of Science, and Google Scholar. Google Scholar for Grey literature, and included all the literature from 1995, English literature, and HIV and syphilis, vertical transmitted related, specific to Sri Lanka. When we created a data extraction tool to make it more systematic and to make sure that we are not going to lose any piece of information in this story. So we had, in the initial version, we had 117 determinants listed based on 4 frameworks from the literature. We'll get to that in a minute. So if you can focus on the center, you can see the center left is the final form. This is the Commission on Social Determinants of Health framework developed by the WHO. And the second one is identified drivers of HIV-related inequalities. This is a USC 2022 paper, but this was informed based on the seminal paper by Dahlgren and Whitehead, early 1990s. Additionally, we also included the socio-ecological framework for prevention of mother-to-child transmission, as well as some of our own work from 2021, exploring how COVID-19 affects the low-wage migrant workers in Singapore, Brazil, South Korea. So this is the initial version we had, just for the information as well as for the sake of completeness. Once we have the data extraction tool, we completed and compiled a comprehensive list, analyzed and organized the data, and finally refined through an iterative process to figure out and rather to develop the final framework. This is, the first figure or the flowchart. So we started with 401 sources identified from the databases as well as from Google Scholar. We had 638 results. For full text review, we had 28. And in the final analysis, we had 8 papers, and we identified 38 unique social determinants that may have contributed to the successful dual elimination in Sri Lanka in 2019. So these are different few ways of looking at the results. These are all the 8 papers. I'm not sure, maybe the authors are here. So if you notice anything that we may have missed, please reach out to us, especially any great literature that we may have missed, because we want to continue to work with the stakeholders and who actually worked on the ground to complete this research and before publication. The important thing is the 5 papers that had mentioned the most number of social determinants and explained how they had influenced the success story in Sri Lanka were all from grey literature. They're all from Google Scholar. So just to highlight how important it is to look for Google Scholar for topics like these. This is another way of looking at it. I think if you can focus on the bold black text on the left side, so you can see these are the 10 most frequently mentioned social determinants. So all of them are mid and upstream determinants. So that's we thought it's a very important thing to notice. The reason being, even when you look at the frameworks developed by the WHO, most of the emphasis is on the political factors and the health systems, delivery of care, etc. It's not more about the downstream determinants. So that we thought is an important thing to notice. We'll get to that later, why it is important. And I'll move on to the more important things. So these were all the determinants that we have developed, identified from the literature. And if you can, this is a very busy slide. We'll try to focus into more specifics. So the blue bold text represents all the determinants that have been cited by at least 3 or more authors or 3 or more papers. As you can see, all of them are mid to upstream determinants. You can see the healthcare services, health system financing, workforce, medical products and technology. So these includes the testing facilities and the service delivery. The same goes to more upstream determinants as well. But again, we labeled as mid upstream because there's some difficulties labeling exactly which is upstream and which is midstream. So we try to treat them as liberal as possible. Again, the same trends. Often more of the emphasis has been around, like for instance, global organizations, international agencies like WHO, the Southeast Asian Regional Office, public policies, antiretroviral therapy drug supply, and health systems and infrastructure. So based on all the information we have in hand, so then we went through a week-long iterative process of finding out how exactly these things interact with each other to bring the outcomes that we wanted, which is prevention of HIV and syphilis in an infant. So this is the framework that we have in hand now. As I said earlier, we want to work with the actual people who worked on the ground to see how else to tweak this, to find out like the real picture on the ground. So there's much more work to be completed to do before we go ahead with the publication. I want you to just take a look at the top of the figure. So we are talking from left to right. On the left corner, you have the upstream determinants, and the right corner, you have downstream. So we are going to go from left to right. I'm not going to go into details because our time is very limited. So we'll just focus on a few interesting things. The center, we have things that are directly related to dual elimination. Because when you read the terms, for instance, political support, private corporations, like how private clinics and hospitals can support in this process, and international organizations, leadership and governance, they seem very, very, very generic and broad. But interestingly, all of them had very specific role in dual elimination pathway, like what they have to do exactly to support, perhaps to identify cases of HIV and syphilis, or initiate treatment, or to referral, etc., etc. So those things on the left corner, things can feed into things like funding, guideline development, and improvement to existing healthcare systems. Like for instance, in 2013, when Sri Lanka first pledged to eliminate dual elimination, and by 2014, I think they were already on it. And the Western Province, Central and Southern provinces were starting the program. And in another year, they developed the circulars, and all the provinces were completed with access to HIV and syphilis testing during the pregnancy, improving the testing rates up to about 90-95%. So that was remarkable. And that's the service delivery part, how all these things feed into service delivery, distribution of services, and healthcare manpower, how they improved, and testing facilities improved. So that feeds into basically access to care, and access to care has a lot to do with individual level things, like how an individual can access to care at a very personal level. So here I just want you to focus on this area. The reason being, there was one case study that we found, a lady from Jaffna who was diagnosed with HIV, but her family was tested first positive for HIV in India. A little bit of a loss to follow up for a while, and however, she was lucky to have a healthy baby with a HIV negative baby. So the interesting thing is, because that also emphasizes how the regional healthcare systems can play a role in this story, but we did not include as a determinant, reason being that is a bit out of scope of our research question. But that's something that we also want to explore further. On the right lower corner, so this is the ultimate outcome, which is the prevention of HIV and syphilis in an infant. So as you can see, there are key 3 pathways that leads to this outcome. So on one hand, we have preventive. So the ability to practice preventive measures can feed into the final outcome. At the same time, once you have diagnosed, having early treatment as well as specific delivery, like for instance, cesarean section for delivery, can lead to, again, a healthy baby. And again, through access to care as well as through knowledge and awareness through campaigns, safe breastfeeding practices can also play a role. There's another interesting story to this, but that was not mentioned in any of the papers, which is access to a formula milk. But that's another important determinant, but that complicates this whole story. So we did not include it at this point in time, but we want to explore that further as well. In conclusion, varied social determinants of health contributed to the successful dual elimination of HIV and syphilis in Sri Lanka, but most of them, like more than 75% of them, were clearly mid to upstream determinants. And there is a notable gap in the literature exploring the influence of downstream determinants, despite these factors may have actually been considered. And why is it important? Because, as you know, these are infectious diseases. Again, as I said, not my focus area, but when infectious diseases, even including the infectious disease of poverty, when you break it down into social determinants, often things there are a lot of overlaps. So there are a lot of cross-cutting indicators that can be easily leveraged to do a lot of proactive work. So instead of, for instance, like this story started from 1954 originally, and then 2002, the first prevention of mother-to-child transmission in Sri Lanka, HIV transmission. And then there's a long story from 2009 and 2013, but there's always a way to incorporate a lot of things through different agencies. So I think that will be a very interesting way to look at it. It is not usually looked at that way. So that's something we wanted to emphasize. And as one of the recommendations is the programs in Sri Lanka should prioritize understanding, documenting, and publishing how various determinants influence their outcomes, with a focus on downstream determinants. And then other low and middle income countries, I think so far only 3 countries have eliminated. I think Thailand, Sri Lanka, and Maldives, if I'm not wrong. And these could be leveraged, especially to identify what kind of strengths they have. So at the same time, when they use WHO guidelines and WHO frameworks, they can also take a look at how social determinants of health work. If they have, for instance, a very strong awareness campaign, they can leverage on those things first, while waiting for funding and other mechanisms to take place. So just a different ways of looking at this issue and infectious diseases in general. And that brings us to the end. Happy to take any questions at the end. Thank you very much.